I was laying there on the bed and I was in pain. At first I thought it was like, you know how you get that gas in your chest sometimes? That's what I thought it was. And then I was laying there and my grandson kept asking me if I wanted to go to the hospital. And I said, no, I'm okay, I'm fine, I'm doing fine. But then the pain started getting stronger and stronger and I couldn't handle it. So that's when I looked at my husband. I said, no, call the ambulance. You gotta call the ambulance. Something's going on, something's not right.
Well, Linda, she started having chest pain and she called 911. She was brought into ER through the EMS. EKG suggested there was a heart attack going on, and everything was done in timely fashion. I saw her in the ER and she was at the verge to go downhill. That means like she was having more pain, her blood pressure was dropping, and we took her to the cath lab right away.
And you talked about just trying for so long to be prepared. When that day it happened, did you expect it would be a heart attack?
No.
Were you pretty shocked?
I was because I tried to prepare myself for many years because on my father's side and my father's father and his father's father, it's nothing but heart attacks after heart attack. And like I said, I did try to prepare myself because I was scared because I know one of us would have a heart attack because of my dad. And when it happened, I wasn't prepared. I didn't know it was a heart attack until the paramedics told me. But when the paramedics got me in the car, in the van, or the ambulance, they took me to the hospital, and Dr. Bassett came down, shook my hand, told me, you're having a heart attack, we gotta get you to surgery now. And she said, if I wouldn't have made it in 5 minutes, I would have been dead. And that's how fast my heart was failing. I was thinking I was gonna die and not seeing my husband and family again.
What are some of the main things? It's a lot different for women than men when they suffer heart attacks, of course. What are some of those symptoms they should look for?
The symptoms are not typical of chest pain. Sometimes they get chest pain, excruciating, crushing chest pain, but oftentimes their symptoms are atypical. That means patient could have breathing problems, patient could have anxiety attack, some palpitation, sometimes pressure in the chest, sometimes not feeling well, sometimes dizziness, and they are going through a full-blown heart attack. Those are different from the male.
And now, can you talk about how he's helped you after your heart attack, and what have you done to change your lifestyle to make sure this doesn't happen again?
I'm having to change my eating habit. I've got to make sure what I eat. It's hard. It's very hard because after so many years eating certain things and all of a sudden, boom, you've got to do this. There's no way around it. You've got to do it. You've got to change it in order for your life to be better, in order for your heart to be better, in order not to prevent another heart attack.
Does the idea of another heart attack keep you strong in making those changes?
Yes, it does, but it scares me. Like I say, I live every day scary because I don't know if it's going to hit me again.
And then we also see how many risk factors are there. Risk factors mean any other associated medical problems, diabetes, high blood pressure, high cholesterol, tobacco smoking, peripheral arterial disease, taking some different medications which are not good for the heart or not good for the blood vessels. So we combine all those things and then we calculate the risk.
If they didn't have me strapped down the way they had me strapped down with IVs and all that, I would have jumped up with joy and gave that doctor the biggest hug of his life.
And it's okay to, I think a lot of times as women we think, I'm not going to ask for help, I need to take care of everyone else, the kids, my husband, I'm not going to ask for help. How important is it for us to ask for help when we need it?
It's very important to ask for help. Hi, my name is Linda Guerrero. I'm a heart attack survivor, and I go Red for Women.